So I hope Komal or Kaushani, are you there? Have you joined back? Yes, sir.
My PPT visible?
Yes, sir. It's visible.
Yes, sir, it's visible.
Okay, thank you.
So this topic is very important topic, and we have Professor Dr. Swapan Joshi sir. Joshi sir is the director of our school, which is basically Nasi school, and sir is also handling very important.
Madam, your voice is soft. Just put it in front of your mouth.
Yes, sir. Yeah, I'll just keep it here.
Uh,
So, sir is handling a very important portfolio, not only as a director, SCON, but also playing a very important role and helping all of us who are involved in research, basically who are involved and dealing with the research in clinical, areas. And he is mainly dealing and handling all such kind of problems, queries. So, sir will take this session and resolve your queries because the ethical approval is a very important aspect once you are going to start your research, especially collecting clinical samples. So until unless you have a clinical approval, you cannot start your work, and it is not at all easy even. So writing a proposal and even filling all the formats, so all such things are very important. So sir will cover those things also. And now just I wanted to hand it over to sir.
yes.
Sir,
Thank
please
you,
take the
Dr.
time.
Neetu, and thank you all of you for joining this session. And it is very important session with regards to the research, particularly in the health and biological research. So you all know. Shall I start? Everybody has joined.
Sir, most of them now are there. I think 2 or 3 people will be joining. You can start with the introduction.
Yes, sir.
Of the IEC. Then I think
Okay,
better we
and
can.
this group involves the only the health related students, no?
Sir, this is a mixed group including biotechnology, nutrition and dietetics, sports science, nursing, healthcare management
Oh,
under the Faculty of Medical and Health Sciences.
okay, okay. So but during the induction program also, I took one class to them.
Okay, sir. So I think they are familiar a little bit about such things.
Okay.
Further, they can ask
Yeah.
specific queries
So
also, and you can.
we'll deal only the practical problems and what are the problems they are facing. Uh, so that
Right. Yes, sir.
that I will cover. So I will skip most of the slides which I have discussed earlier with them. So we'll go directly to the how the ethics committee works and what is the significance, how it functions, and what is the importance of the ethics committee in the health research. So basically, I would like to just introduce that the research on the human participants. So those the researcher who are involving the human participants. So that is important to look after the ethics in that. So whenever we are doing any research, the research is the scientific inquiry. So the science is involved in that, and which is aiming at the developing the generalizable knowledge. You are creating knowledge. So there are two components of the knowledge. One is the knowledge dissemination, which we are giving through the our teaching profile, and the generating the knowledge. While we are doing the teaching, we are generating the knowledge also. We are creating some policies, we are creating some devices, we are creating some good output so that it impacts on the society. So we are helping the humankind understand the disease and to understand various procedures. We understand various pharmacological agents. Understand? So for that matter, we have to just see that we are doing the research ethically. The proposal of the research should be ethically sound. So for that matter, we have certain issues which will come, and because the system of medicine, because it may be the allopathic medicine, or it may be the nutrition, it may be nursing. So all are doing the researches on the human participants. So how we can take care of the human participants, we will deal in this session. So today's our topic is the introduction, significance, and functioning of the Independent Ethics Committee of SIU. So what is the ethics? So basically, I should not ask you any the questions on the ethics. What is the ethics? So everybody knows, they understand also. But what happens in the ethics? Everybody knows, easy to talk, but it is difficult to walk. Means it is difficult to follow. Understand? We all know. So we should not harm, we should not create a discomfort to the participant. But certain times see, I have to respect the researcher, because researcher is a focused person, because certain times he will not see in and around, but he is focused. I wanted to do something good for the people. So for example, I will tell you. So during the COVID time, so many scientists or many researchers has tested a vaccine. Understand? It was a very revolutionary work they were doing. But certain times what happened, during that vaccination time, or the testing time, so it is a possibility of the harming the participant. There might be some adverse reactions or something like that. Anything can happen. It might be the physical harm, or it is a psychological harm, or it is a emotional harm. So that happens in the research. It happens, it is a possibility. But as a researcher, we have to take care of the participant. If suppose if there is a minor discomfort to the participant, or minor illnesses may be created, so researcher has to take care. If you are taking care of the certain abnormal things, so then you are the ethically, there is no any problem. So basically, ethics is a good conduct, good character, and motives, and it is concerned with the determining what is a good or valuable to the all the people. So what we have to see is a benefits to the all the people, means masses. Understand? So we have to have certain code of conduct within our boundaries. So we have to maintain the moral principles. So people's behavior, choices, preferences, culture. So that all we have to respect. In a short, we have to respect the humankind, their physique, their psychology, their emotions. So there some discomfort that we have to take care. So in the past, what happened during, you must have heard in my lecture during the induction. So there are lot of brutal and very damaging research was taken care in the, particularly in the health science. Understand? Certain times we are using the patients. Sometime we have using some drugs. We are giving some drugs to test the drug, and there was a huge amount of damages to the mankind in the past. You have listened that the Nazi experience was one of the brutal experiment was conducted during that World War II, and by that World War II experiments, there are a lot of patients were used, lot of prisoners were used, lot of the disadvantaged people were used for the researches, and then it has come to the notice of the government and some philanthropic persons, and the first guideline has come up that in 1947, that is the Nuremberg Code, based on that brutal experiments. And it is the first document which was mentioned that voluntary consent has to be taken. And later on, the World Medical Association has come up with the good document that is called as a Helsinki Declaration in 1964. And in that declaration, individual rights were discussed. And that Helsinki Declaration revised in 1983, 89, 96, 2000, 2008, and 2013. So in that there was a schedule Y. What was the see? It is a particularly just protecting the rights, dignity, and welfare of the participants. And later on in 1979, again it is the Belmont report has come up with the basic ethical principles in that autonomy, justice, beneficence, and emphasized informed consent and review by the ethics committee. So that was the Belmont's report. And later on, the Council of the International Organization on the Medical Sciences and WHO has come up with the SIOMS guideline, that is reporting of the adverse drug reactions, safety of the research participant, benefit and risk balance, need and principles of the pharmacovigilance. So that has come up, and in 1996, the good clinical practice has come up. So, in this, I would like to tell you that Indian government also come up with the very good document, that is the National Ethical Guideline, and it was first released in 1980, and later on it is revised in 2007, and recently the ICMR guideline 2017 is now existing, and which is available for all in the public domain. If you will go to the Google, then you can just type ICMR guideline 2017. You will get entire 131 pages document, and it involves each and every guideline which is required for the researcher, health researcher, non-health researcher, stem cell research, clinical trials. All this important information is available in the public domain. So basically, the stakeholder of the research are the participants, principal investigator, funding agency, sponsors, and ethics committee. Understand? So most important stakeholder is a participant. Then even the principal investigator, certain times we are forgetting the investigator also, principal investigator and co-investigator, of course, because we have to also see that we ourselves, we are not harming. Maybe the may not be physical, but psychological, emotional. We should not take too much of stress. It is a very patient and unhurried activity. Any research is a patient and unhurried activity. We should not create any trouble to ourselves and to the others also. So the principal investigator is also important in the research. Funding agencies, certain times, particularly the pharmaceutical researches are done by the funding agencies, because they wanted certain type of medicine should come up for maybe now we have recently heard that the USA has invented some drug for the fighting the cancer. And also, so unless there is a fund, huge fund is required to create some knowledge, create some devices, to create some drugs. So funding agencies are also important, sponsors are also important, and of course, the ethics committee is also important. See, ethics committee. I cannot say it is a like a policeman or something like this. But that ethics committee gives you the guidance. They gives you the some suggestions, modifications, etc. It is not a they are not what you can say. It is not a hurdle to the researcher. So that we have to understand. And because we read is your documents. So document, if suppose it is a properly put up the document to the ethics committee, then there is no any problem for the ethics committee to give you the approval. Okay. So the fundamental principles for the participant is a respect for a person. So we have to give respect for the participants, respect for their autonomy. Their freedom should not be damaged. They should be protected against the dignity and rights of the participants. We should give proper due respect to them, give a dignity to them. Understand the maximize benefit and minimize harms. So whenever there is a maximum benefit, there might be the minimum harm. So that we have to understand, and that we have to disseminate to them. And every research should be the good for the society with justice. So that we have to maintain the principles. And for the researchers, integrity of the researcher is very important. They should be very composed. They are very integrated. So they will have very sound philosophy in their mind. So they should prevent misconduct, misuse, maintain high standard of the research. They should have the respect for the authorship and publication, because our job will not finish unless you publish that whatever you have done during your research journey. There should be the honesty, objectivity, carefulness, openness, respect for intellectual property. That is most important thing. The copyright, you can create the patents. So patent has to be registered. Your research has to be registered. So that is most important. Confidentiality, because we are collecting the very sensitive data from the people. So the confidentiality has to be there. Responsible publications is most important thing. So that all has to be maintained by the researcher. Then responsible mentoring. So if the senior researcher is there, particularly the principal investigator along with the junior co-investigators are there, we have to give the mentoring to the subordinate, respect for the colleagues, social responsibility we have to maintain, non-discrimination. So there should not be any bias, the caste bias, religion bias, geographical bias. There should not be any bias. Even in the proposal also, you should not have to create that biasness. Enhancing the competence from the own professional advancement and ensuring the legality. So legal harm also we have to see that. So in that, investigator should avoid underprivileged and the vulnerable. Well, if suppose the vulnerable population you are including in the research, particularly small children's, the women's, pregnant women's, postnatal women's, any type of patients, the patients with the mental disorders. So these all are the very vulnerable population. So special care has to be taken for the, because see, we are creating the knowledge. It may, so creating knowledge doesn't limited to the only the adults or the very matured person. Might be there you might be physically challenged people also. You wanted to do something for them also. Understand? So we have to include, but we have to take care properly. So we should have the expert in the field. Whatever the your expertise is there in that field, only you have to conduct the research. Consent has to be taken. When you are using the animal data, the special care has to be taken as per the ethics committee of the animal data. Welfare and safety of the participants, and we have to take approval of IRC, RRC, and doctoral committee, whichever is applicable to you. In the funding agency, we have to control over the methodology, because certain times they guide you, they give you some suggestions, methodology, control over the publications, control over the content to publish, misuse of information by funding agency. Sometime the funding agency may influence the researcher. That time we have to take care. So we have to negotiate whatever the information or whatever the we are publishing, so that we have to take care. Then in the research ethics, we have to have certain things, experimental design. So while writing the proposal, we must have certain things very scientifically, because see, the proposal should be a scientifically weighted. Understand? For example, appropriate design, appropriate sample size, appropriate length of the that particular data collection, that has to be there. Then it becomes a scientific. Information to research participant, properly information has to be given. There is a certain formats which are there in the on the ICMR guideline. Also, we have to identify the target groups. We have to weigh for the risk and benefits. So whatever the risk to the participant, we have to inform them. And what are the benefits of after the doing the research, and when the result will come out, what is the benefit? For example, I told you that vaccine. So vaccine, the one it is tested, it might be the harm to the participant minor or intermediate, but it is millions of the peoples will be benefited by the vaccines, by the drugs, okay, by the some of the procedures. So informed consent has to be there. Then we have, so in certain cases, we have to maintain the privacy, anonymity, some certain data we have to keep confidential. So that all has to be taken care. And of course, the feedback has to be good from that particular research. When whatever the you are publishing, that has to be in a proper format, in the very impactful journal we have to select, and we have to publish the data. So all the principles are put into the practice through the formation and operation of independent ethics committee. So the ethics committee is very vital in the journey of the research. So we have to have the knowledge how it works, what ethics committee is expected, and how I can get very easily the permission from the ethics committee. That we will discuss. So role of ethics committee, what ethics committee looks into it, protect the study participant. So first and foremost principle of the ethics committee is the protection of the participant, whether you are protecting the participant or not. Understand? You are some certain times you are taking the blood from the patient. Certain times some procedure has to be conducted on the patient, on participant. So that uh, we are not stopping them to do all the things, but certain protocol, certain SOP you have to follow. So that entire study should be the ethical declaration of the conflict of interest. If there is any conflict of interest, maybe the student teacher relationship, or the researcher and the participant relationship, so that we have to take into consideration. Review of the protocol from scientific, ethical, medical, and social aspect. So the proposal, whatever you are writing the proposal should be a scientific. It should be ethical. We have to see how that particular flow is there. So in certain times, the researcher in the introduction is writing something else, and in the methodology they are writing something different. So that flow that has to be there. So whatever you wanted to do, it is a narrow down process. So research is all about the knowing the from the less to more. Means you have to take a small component and explore more. So uphold the ethical and international standard. So we have to just have whatever the ethical international standard is there, whatever the procedure, whatever the protocols you have to follow, that all has to be taken care during the research. So ethics committee, so every ethics committee, wherever you are going in across the India, every ethics committee has got their own SOPs, standard operating procedures. Understand? And in that standard operating procedures, so these all components are included. It is a constitution, confidentiality, conflict of interest, training and investigation, categories of the protocol, agenda, review of the medical devices, resubmitted protocol, protocol amendments, continuation of the protocol, review of the final reports, review of the AEs, adverse events, managing the termination, waiver of the consent, site visit, dealing the grievances, emergency meetings, archiving the study records, confidentiality, AV recording procedure, dealing the vulnerable population. Means whatever the doubt comes to you, you are always look into the ethics committee SOP so that you understand. If suppose you wanted to have a waiver of the consent, understand. So which type of proposals are given the waiver of consent? So which type of proposals are review of the adverse events? So that you can go through that document, you can read the document, and then you can approach to the ethics committee. So for that matter, SOP is very important, and this SOP is recognized or approved by the government of India. And all the ethics committees are under control of the central government, not only the state government. It is, if suppose if you are doing the clinical trial, then Central Drug Control Department of Government of India, and for the biomedical and health research, it is a director of the health research, DHR, which comes under ICMR, Indian Council of Medical Research. So these ethics committees are approved and licensed by the government of India, and as per the guideline given by the government of India, it works. So whatever the things are there, it is a very transparent, very honest, and it is very clear cut document. Even in the you can see the ICMR or you can SOPs. So both the documents are in sync with each other. Okay, so when the proposal comes to us, we categorize the IEC review, the categorization. So certain times, so we give the exemption. Means you don't have to come to the ethics committee. The proposal will be sent. Those proposals which are having less than minimal risk, so that will be given the exemption. Means there is no need of the ethics committee review. So we give a certification that this proposal is exempted from the ethics committee point of view. Another proposals are the minimal risk proposal. Might be that there might be the minor discomfort. You are just giving some injection, taking out some blood from the finger prick, or some 1 cc or 2 cc blood. So that may create some minimal risk to the participants. So that is expedited. Again, here also we don't require any presentation by the researcher. So these two, exemption and expedited, there is no any connection of the ethics committee and the researcher. They just send the proposal. We just categorize that proposal and we give the approval letter directly through the mail. And but third type of proposal, these are the more than minimal risk. Understand? Certain times you are conducting research on the vulnerable population. Might be children are there, pregnant women are there, patients are there, psychiatric illnesses are there, prisoners are there. So for them, we are including some tribal population. We are doing some research on the stem cells. So where there is a human participant is involved and vulnerable population is involved, we have to have the full review committee. The researcher has to come to the ethics committee. They have to present the proposal. They have to face the questions from the ethics committee members. If you are giving a successful answer or satisfactory answers, then within 10 minutes we are just giving you the whatever the result of that particular review. If any modification is required, there and there itself we can see that sample size is less or sample size is more, you can cover this one. So that suggestions are given during the meeting itself. And subsequently, the minutes of meetings are written and it is approved and then given to the participants. Okay. So how we are certifying the level of risk? Understand? So it is risk associated with the exempt, minimal, and greater than the minimal. See, exemption to whom we are giving the experiment is without risk to the party. There is no risk of the participants. Understand? The researcher and even the environment. For example, anonymous questionnaire. You are sending some questionnaire to the participants. Understand? So there is no name or nothing, no their identity is disclosed. For example, standardized education test. For example, we wanted to see whether that particular conference or workshop or seminar is effective for the dissemination of the knowledge or some that particular knowledge or not. So that doesn't have any harm. Understand? So these comes under exemption. Okay. Then the minimal risk means expedited. Although the safeguard must be present, usually no more risk than the one would face in everyday life. That certain medical diagnostic test we are going. So otherwise also, not only for the research, we are going for the annual medical checkup. We are taking the blood. We are undergoing the physical examination and all. So in the same way, in certain researches, so the same procedure is followed. So this comes under the minimal risk. Research on individual or group behavior that involves no manipulation of the subject and is not stressful. The research on perception, cognition, motivation, identity, language, communication, cultural beliefs, practices, social behavior, that comes under minimal risk. Because certain times certain questions are also very sensitive. For example, for the women, understand, we are asking some personal questions, so that is not actually as per the ethical guideline. So there is a certain SOP for that, ki how we can ask the sensitive questions. Understand? Research employing survey, interview, history, focus group, program evaluation, human factor, quality assurance methodologies. This comes under minimal risk. Means there is a slight discomfort to the participants. So that comes under minimal risk. Then there is a greater than minimal risk. Can cause stress, pain, injury, or even death. Particularly during, I told you that during the COVID time, because we have to include some COVID patient in the certain clinical trials. And now it might be that is that is due to the disease or due to the vaccine or any drugs which are tested. So research with the children and vulnerable populations, research involving experimental drugs or devices, invasive procedures, any research involving blinding. So these are the greater than the minimal risk. So greater than the minimal risk goes into the full review committee. Okay. So these are the ICMR guideline which is given in the ICMR this thing, because these are the some of the things which you can refer page number 36 and box number 4.2. You can refer whenever you are putting your proposal. You just view this box and you can suggest yourself because my research falls on the less than minimal risk or the minimal risk, minor increase or minimal risk, or more than the minimal risk. You yourself can study, you can see, because it is very elaboratively given in the ICMR guideline, and that will be highly benefited to the researcher. Particularly, so I put this slide for the benefit of for the researchers. Okay. So informed consent is most important document. So see, ethics review, they are looking into three, four documents. First one is your proposal, including application form, then informed consent, your tool and technique. Okay. So these are the three, four documents we are very important. So the informed consent should be written in the good language, so it is easily understood language, short sentences. The language should not be confused. Okay, should be checked and readability. Flesh reading case, understand. Then in our circumstances, ask unconnected layperson to read, do field testing. So pilot study and all, so you can do that. Okay, it must be in the local language. So if suppose if the less literate people, if you are including in your research, then we have to just see that it is developed in English, then it is translated in the local language, and ask another person to back translate to English, from Marathi to again English, and assess the changes which has happened. It is called as the back translation and all. So that gives you the high clarity for the whatever the language you have used. Okay, and in the consent form, what the elements which you have to include: name of the study, organization at the top, introduction and background, purpose of the study, procedure of the study, number of visits that are required, risk and benefit, what if new findings emerge, premature discontinuation, because the participant can withdraw at any time. We cannot force them to continue. Understand? If you don't want to participate, they can withdraw at any time. Compensation issues, if certain things are happened. For example, if suppose during the clinical trial, or during anything, if something goes wrong with the participant, so what compensation will be applicable? Confidentiality issues, if you any problems or questions, then whom they can contact, and the researcher signature. So these are the some of the standard which is already there in the application form. So it is publicly available application form on the website. How does prevent the plagiarism? So plagiarism is also one of the important thing, and it is also it comes under the ethical guideline. Be honest, always quote another person's work, try to use your own work as much as possible, work hard for your idea, cite other person work at every level if it has been used. Understand? So you have to give the proper references, proper acknowledgement, proper citations. So if you are using somebody's work, that all the researcher knows. Understand? Also keep research notes. So whenever in your journey of the research, you maintain your diary, what you have done for the research in that week or in that month. Maintain laboratory records, stringent internal and external quality assurance. Then keep data safely. Whatever you are collecting the data, your database should be kept safe. Maintain the data and records. Include values and foster transparency. Do not worry about the failures. See, certain times the researchers might have the result in the negative result, but don't worry. It is a part of your research. So follow the principles of ethics at every phase of research for quality conduct of the clinical trial and ensure safety of the study participants. So in short, so your research journey has to be taken care if the participant is there. So they have to protect the participant very carefully. This continuously evolving field, every investigator must get trained in the ethics and human subject protection. So every year we conduct a workshop for all the researchers. Now also it is announced one training program of 3 to 4 hours training program on 18th of February. So you can inquire with your directors. If you have not received any information, you can register for that. And very renowned persons like Dr. Raman Ganga Khedkar, Dr. Ravindra Gui, Aditya Apte, and many more interaction will be there. And all your queries and all your questions will be solved in that. Thank you so much. All the best. And I have another document to share. You are able to see this document?
Yes, sir.
What document? What document? PhD program?
Yes,
Yes,
sir.
sir.
Yeah.
Yes, sir, we're able to see.
So this is what you require to follow. See, first is your after selection and payment of the fees and induction program. First step is in payment of the fees and attend the induction program. Then you will get the provisional registration certificate, which is applicable only for the nursing student. You will get the provisional and registration certificate. Then you have to undergo the pre-PhD coursework, which is of maybe in the 2 or 3 sessions. There will be a pre-PhD examination. After the pre-PhD examination and result is declared, you have to obtain the result. And Dr. Neetu Mishra and Dr. Pohekar will be the nodal person for this pre-PhD examination and the result declaration. And the RAC should happen after your PhD examination. RAC within 2 months after successful pre-PhD coursework. Then your registration certificate is your PhD will be registered after your RAC. And then after registration, because your title is clear, then you have to go for the IEC. If applicable, means if suppose your participants are the human, then you have to go for the IEC. Then progress report every 6 months you have to submit to the CD department. Then the pre-PhD thesis submission and presentation, final thesis submission, and defense and viva. So these are the, in short, the flow chart for the PhD program. Okay. Yes. Now, sharing करून घेऊयात. Sharing केलं ना? हे मोठा आहे तर. So the forum is open for the question answer. If any questions are there, we have still 10-12 minutes are there. So we can take some questions.
Sir, I have a question. Sir, if we are
Tell me in which area you are conducting research and what is your name and your area of the specialization.
okay. Sir, my name is Kriti Gupta, and my area of research will be in molecular biology. So I wanted to ask, like, if I will be purchasing monoclonal antibodies for my research work, then will it come in minimal risk or
From where you wanted to purchase?
sir, from a research lab?
Research lab means no direct interface with the
No,
participant, no?
No.
No, then there is no any question. Only you have to take the waiver from the ethics committee.
Okay, sir. Thank you.
Yes. Anything else? You understood the topic well, or there are some areas you require more interaction?
Understood, sir.
Okay. Okay. Any
What is the
questions?
process of, sir, what is the process of getting that provisional registration certificate?
No, you don't have to do anything. It is automatically you will be given the provisional certificate after your induction program. It is only for the nursing student because see, nursing PhD is governed by the Indian Nursing Council.
Yes,
And
sir.
as per Indian Nursing Council guideline, the provisional registration certificate should be given to the candidates. So that for that matter, we are giving the provisional registration certificate from the city itself. You will get it.
Okay, sir.
Yes. Anything else? Yes, Mamta, Anindita. Any questions?
Uh, Hello, sir. This
No,
is
sir.
Govin. Thank you.
Okay.
Sir.
Okay.
Yeah. Uh, Hello, sir. This is
Yes.
Govin. So, my project, my PhD work. In my PhD work, there is a primary data collection, and I'm going to deal with the individuals. Like semi-structured questionnaire will be there, and I'm going to assess, like the kind of interview the individual. So in this case, do I need ethical approval or anything else?
Yes, means first thing is there कि whatever the data you are collecting from the human participants, you have to apply to the ethics committee. So there is a
Okay,
prescribed format which is available on our SIU website. I will give you the where you will find it.
okay,
Then what type of data? See, if you are just asking some simple questions, so
mm,
we can give you the waiver. If there are certain questions which are little bit complicated or some sensitive data you are collecting, then you have to have some expedited approval. So still we give the approval without any presentations. And if some certain really vulnerable population or some critical questions are there, then we have to have the ethical presentation.
okay, okay. So
What is
the
your
question will be
Pranali, what
normal.
is your title in which what sort of questionnaire you wanted to prepare?
Well, it is related to the state of mind. So I'm going to assess the mental health. So there will be no, confidential or personal question. It is just a random questions, and yeah, so those kind of questions will be there.
No, this will fall under the full review committee because it
Okay,
involves the some mental health, whatever the mental health related questions are there, because psychology is a differ for each and everyone. Understand? So I will give you some examples also for that. See, you must have heard about the some stressors. Understand? There are major stressors like if suppose if any death in the family or the divorce or this thing, these comes under the major stresses. Understand?
okay,
But there are micro stressors also. Like I will tell you, if suppose if you are in the office and suddenly your wife calls you in the office, so you get some sort of stress. About what happened? Understand? So like
okay,
that, certain questions. It might be um, some family issues and all. Understand? So it doesn't involve any stress and all. But what happens? The same questions, if you will ask to the five peoples, their reflections will be differ for the different people. Understand?
Okay.
So that's what some questions are also very important to look into it. Understand what
Yeah.
sort of questions you are asking, to whom you are asking, in which area you are asking. Understand? If straight
Yes.
the personal question is there, so people might have certain issues. So that we have to take care. That's all.
Okay. Thank you. Thank you, sir.
So I know that I'm going to have to go in front of the ethics committee because I am looking at getting blood profiling done. So there would be that, and also formulating a nutraceutical related to a certain disease,
Yeah.
and then testing it as to seeing if it works on a control group, and it'll be randomized and double blinded as well.
Yes. Yes.
So, how do I go about ensuring that I get my ethics? And is there any process that I could follow to, reduce the chances of it not really, getting accepted?
Yeah. Yeah, there is no problem. You see, even in the nutraceuticals, or you are some creating some recipes and all. So just you have to just apply to the ethics committee what you are going to do. It has to give in detail, because what ingredients you are using, to whom you are testing, so that all has to be included in your proposal. And we certainly it comes under minimal risk only. So we will review, and we will give you the approval. There is no problem.
All right, thank you.
You can just go through the application form. You can write the application form. So there are a lot of columns. Only yes, no columns are there. And there is one space also for your communication. So you can put there key whether it falls into the, you refer the page number 36 of the ICMR guideline. So where it falls, whether it is a minimal risk or whether it is a more than minimal risk, and based on your inputs and recommendation, we can go through the proposal, and we'll give the approval.
Thank you, sir.
Yes. Anything else?